right, Dr. Malcolm King is a member of the Mississaugas New Credit First Nation. He is one of Canada's more prominent experts on Indigenous health and has served as the scientific director for the Canadian Institute of Health Research Institute of Aboriginal People's Health. He helped lead the development of a national health research agenda for improving wellness and health equity for First Nations people, Métis and Inuit in Canada, and is now the scientific director of the Saskatchewan Centre for Patient-Oriented Research, a provincial sister to the Institute to Hotıì, ts'eeda. So nice Yellowknife welcome for Malcolm King.
Thank you very much for that kind introduction, and I'm happy to be here in Yellowknife, in the territory of the Yellowknives. So the acronym for the Saskatchewan Centre for Patient-Oriented Research is SCPOR. So when I took on the job a year and a half ago, they started calling me the skipper of SCPOR. I want to talk about two things in my 10 minutes here. I've already used up a half a minute, I think. One is about patient-oriented research and how I view it and how our network of support units across the country view it. It's many different ways. And the other is wellness research, because in a way that's the theme of this conference and this evening. Research traditionally was done by researchers. I'm a researcher. And I'd like to think of this introducing, so research is good, but it's only one head. Well, there are many different heads, but we all kind of think alike. And so research is rather focused, and it doesn't involve necessarily all the other kinds of things that ought to be there. So if you think of patient-oriented research as a three-legged stool, I usually have a PowerPoint behind me, but try and imagine a three-legged stool. And that's the minimum number of legs for a stool to be stable, to be able to stand on its own. So research done by researchers alone is like a one-legged stool. It's pretty darn unstable. You can't just leave it there, and it's not that much use. So the research system thought about this, and they said, let's bring in the health system people, the decision makers, the health professionals, and we'll get their ideas on what needs to be researched and what needs to be done with it. And so research then became like a two-legged stool, the researchers and the health system people. But it still wasn't stable. It still couldn't stand on its own. And so the third leg of the three-legged stool is the people, the patients, the families, the communities. Now, it's not just political correctness bringing in patients, families, and communities into health research. It actually makes good sense because patients, families, and communities have an expertise of their own that is complementary to the expertise of researchers and health system people. It's lived experience, living experience with whatever it is that people bring in, living experience with diabetes, living experience with HIV, with cancer, and it's living experience with wellness, with resilience. And this, together with the expertise of researchers and health system people, makes us much more whole as a research team. So wellness research, I wanted to talk about that too. Wellness research, so we all want to be well, and so who's an expert? Well, there's expertise in terms of living well with diabetes. I think we've all heard that kind of term. Living well with HIV, living well with cancer. And that's very important. People with those experiences, the patients, families, and communities that have those experiences with specific kinds of diseases or conditions bring that important aspect, that expertise to research teams. And they need to be involved actually in all aspects, not just being, deciding on the research agenda. That's extremely important, but also whatever else that they can do, taking care of the research, taking care of the findings, implementing the findings, taking them to the decision makers and making sure that they get put into practice. But it even goes beyond that, because wellness isn't necessarily about any particular disease or condition. It's about resilience, it's about wholeness, it's about mind, body, spirit, soul, all the things that make us well and keep us well. And so what we're hearing from our patient families and communities, and certainly the leaders in this, are First Nations, Inuit, and Métis peoples in Canada. We have something to teach our colonizers, the rest of Canada, about the importance of wellness and resilience and strengths-based. We've been doing it for a long time within Indigenous health research, and the rest of the country is starting to catch up. So that's an important part of what we do in our patient-oriented research networks. Well, what is it that makes us well? What is it that keeps us well? So from the point of view of wellness in the context of, say, diabetes or HIV, it's that resilience that allows people to be better able to live with the condition or disease they have. But even more important in the big picture, it's keeping well before you ever get any of those things. So in the absence of any disease, wellness is the concept that we need to deal with. I have one final thing that I would like to introduce, and that is a little bit of a complicated phrase, the colonial etiology of disease. We've heard a lot about this in various ways. I thank Donna May and Marie for their analogies about colonial history and the analogies of parasites and germs. But down underneath, it's the colonial, it's colonization that has led to the poor state of Indigenous health in this country. We've heard that from the Truth and Reconciliation Commission. So in order to deal with these issues, we have to deal with colonization, and we have to deal with it in partnership with the mainstream community. This is part of reconciliation, but we, the Indigenous peoples of this country, need to be part and parcel of dealing with that. We need our youth and our elders and our communities to be leaders in this, and to invite the mainstream to be part of dealing with reconciliation and strengths-based research. So those are my main messages, and I thank you for your attention. Miigwech, masicho.